So they are different. It doesn't sound very convincing. I'm Dr. Xiao. I'm from IMAGO Aesthetic Clinic. Welcome to our second episode of Aesthetic Doctor Answers. So today I'll be answering some of the common questions our clients have, and hopefully we can all learn something together. So the first question I have over here is are Botox and fillers the same thing? They are different because they have different functions. Botox is a compound that actually helps to weaken the muscles. So usually we use that to target wrinkles, active wrinkles, and also help to soften the jaw. Some people have very square jaw, that will help to soften the look. So that is Botox. The results for Botox usually last about half a year. For fillers, it's actually to replace the volume that you have lost. As we age, we lose volume and the skin starts to sag, especially areas around the temples, under eye, the nasolabial fold. Some people use that for chin, nose enhancement. So they are different. It doesn't sound very convincing.
Do you use Botox?
Yeah.
When you squint, right? Does it feel weird?
No, because nowadays when we do Botox, we do it very naturally. So it depends on the individual as well. Some people they like a frozen look, so we use more. Whereas some people they like a very natural look, so we just do a little bit. You still have the lines, your expressions are all very natural. It's just that it doesn't cause a deep line. Because once you have the deep line, it's very hard to reverse next time. So the next question I have over here is regarding the eyes, how to make the eyes look better and not so aged. So usually when we look at the eye is a 360 structure. We usually divide into three areas: the top part, the side, and then the bottom. Top part, usually the problem is droopiness, loss of double eyelids. And then the side, usually we have the crow's feet, wrinkles, and then under eye, same thing, fine lines, dark eye circles, sunken eyes. So the easiest to treat actually is the side and the bottom, and then the top. Because with the top, usually as we age, we lose collagen, we lose volume, it starts to droop. The best way to do that would be surgery, because it can cut off the excess skin. For people who don't want to go through that, there are some treatment options available. Usually we do machine-based treatment, such as the HIFU, RF. These are all very natural treatments that go over the top of the eye. The energy emitted by the machine helps to stimulate collagen. So with that, you get the eye lift. The results are usually gradual and you have to repeat it every 6 to 12 months. For the side of the eyes, quite straightforward. It's usually the easiest to treat and higher satisfaction rate. Because with the crow's feet, it's due to muscle contraction. You just do Botox. A little bit of Botox will help to relax the muscle, and then the results would usually last about 4 to 6 months. The other tricky area to treat is the under eye, because there are many different problems that can arise from that. Your eye bags, or the eye circles, your fine lines, your teardrop. Different people have different problems. How we treat it usually is again based on the individual condition. Some of the common treatments that we do to help to reduce, for example, eye bags, the eye circle, is using fillers. They will help to replace the lost volume so that the area doesn't look so sunken. Sometimes we use lasers as well. Lasers can help to target the pigmentation of the eye circles. However, with lasers, you need to repeat every 2 to 4 weeks. Whereas for fillers, depending on what kind of fillers you use, the result can last anywhere between 1 year to 3 years. So to sum up, if we want to target the eyes, we have to first look at which is the problem area, and then also is it the top, is it the side, or is it the bottom. And then after we establish that, we go through some of the treatment options available. So the major treatments that we have include machine-based, such as HIFU, RF, We also have injectable treatments such as fillers. We have endurance, fibro, all these. And also we have thread lift that can be used for the side, for the bottom of the eyes. And also we have Botox, which will help to target the growth speed. Next question over here, what do aesthetic treatments Next question, what treatments do aesthetic doctors do for themselves? Everything. We are very vain, we have to do everything. Before I came into aesthetic, I was very scared of all these treatments that anything you tell me that's needle or what, I'll stay far away. Maybe machine-based treatments still can, but after I came into this line, I realized that it's not about vanity, it's more about just trying it out so that I know what the feeling is like. When people ask me whether it's pain or not, I can give an honest answer. When people ask me what's the downtime like, I can share with them from my personal experience. So I find that much easier to relate rather than just telling them in theory. And so far, I would say actually most treatments, if people tell you no feeling and very comfortable, are usually not true. Of course, you definitely will feel something, but is it tolerable? I would say yes, because number one, the treatments we usually do anesthesia. Number two, most of the treatments can be performed quite fast, even things like threading, machine-based treatment, fillers, they are usually within about 5 to 10 minutes. So once you do it, you don't have to keep repeating like on fillers or this. You just think you do it half a year, once a year, and then the result lasts you throughout that period, rather than going through the hassle of putting masks every day, putting makeup every day. So that's something I can accept. At the same time, I do find that the results are more significant as well. So for example, last time when my face is oily, I'll just use the wipe, and after that it stays clear for maybe half a day, 1 day. But then now I'm doing Botox every half a year or so. Then the skin is very smooth, and I don't use a lot so that it looks very natural. When people look at me and say, oh, why your skin so good? And I'm like, really? Actually, it's just Botox that I did like 3 months ago, and now I don't even do anything. Alright, so I hope that you have found this session interesting, and if you have any questions, message us on our TikTok, Instagram, or YouTube page, and we will get back to you as soon as possible. So, I will go now.